So why don't hospitals have a system where patients can list themselves or be listed on a website, on an official healthcare website, and have other members of their community or their area donate money to help with their prescriptions? So, it's not like people won't donate. People donate hundreds of thousands of dollars to random GoFundMes where people, get in trouble or lose their jobs for saying words. So, of course, people will donate. People care about others. And the patients would only be eligible for listing if they A, gave consent, B, were anonymous, as in their names were anonymous, and C, the prescriptions were officially confirmed by doctors, so the patients couldn't themselves exploit the system. It could be exploited by others, but there would be an automated system bringing the patients with the lowest proportion of donations to the top constantly, which basically means, let's say a patient needs $50 and a patient needs 40. The patient that has 10 out of 40 would be higher up than the patient with 20 out of 50. So that there is no, bias for first come, first served, or the patients at the top wouldn't receive the most money. And there would be a cap to the donations, which is the prescription amount. So let's say a prescription, again, costs $50. Nobody would be able to donate over $50. And once $50 were received, donations wouldn't be possible until the patients needed another prescription. This would help hospitals save thousands or even more, and would also help patients because it would prevent them from reaching a state where they cannot afford pills and therefore end up in the emergency department due to some life-threatening issue, which not only requires critical and life-saving care and costs the hospital a lot of money, but also helps the patient maintain a better state of health. And it would also strengthen the psychological relationship between patients and hospitals, because it would spark a realization within patients that the hospital isn't just using them as cash cows and actually does care about them and wants them to get better. And yes, fraud exists, and so does embezzlement. But the reality is, if you don't trust the people in charge of the system, you didn't trust them anyways. Because any number of stringent security measures can be implemented on an official website. But there are some people that will always want to take advantage and always be greedy and want more. And the people who do that, we're going to do it either way. And by the way, the alternative to this is a regular capitalism system or a heavily underfunded and corrupt public healthcare system. So having other members of one's community, area, city, even country donate to them clearly serves a purpose, and clearly, while it may have issues, do you prefer the current system, or do you prefer an innovative future system where everybody can help and chip in with healthcare? And mind you, this is not some random charity or GoFundMe where GoFundMes can be exploited and people can lie. This would be heavily monitored, at least the prescriptions would be, and a charity, you don't exactly know where your money is going. Here, you know exactly where your money is going. So, that's it.